250 DNA tests coming into the laboratory each month. So if you look at the very bottom, you'll see ongoing investigation sexual assault kits that we have completed 2014 from the 6-month period in FY 17. And we still have 1,745 sexual assault kits remaining to be worked. And that is those figures are not stagnant, because as I said, we got 250 new new tests coming in each month to the laboratory. Total in the crime lab of all DNA, not only just sexual assault kits, but DNA related to homicides, assault, all other crimes, we have 5,800 cases still remaining to be worked. So that is why we need the continuation of the funding for the rape kit supplies. It cost us, a rape kit cost about $200 to purchase. Total amount to complete a rape kit, including the scientist's time, is $725 per kit. But even though this is expensive, but as we all understand, DNA is the law enforcement prosecution tool of the century. Extremely important to all manner of cases, not just rape cases. The second item in our amended budget is to provide one-time funds to purchase the furniture and equipment for the Hull McKnight Georgia Cyber Innovation Training Center, which will open up in July of this year. Now, GBI, in the governor's budget, he has put in money, and I hope the legislature will go along with this, to have 8 positions in the cyber center. This would include a GBI supervisor, a digital forensic investigator manager, 4 digital forensic investigators, and 2 special agents. That's $1.1 million. We have space in the center for 20 personnel, but this is be partial staffing for that, which will work out well, because that'll allow us to start the center off with a sufficient workforce to get some work done. So those are our 2, but this center has got to have some specialized equipment and furniture to be able to operate. We've got the space, and this will give us the equipment to do the work. Our center is going to be based around, to my knowledge, we're the only center of this nature that will have a law enforcement component in it that will actually be working cases. So this will be an investigative work unit handling all manner of cyber crimes, but particularly downloading information from digital devices and technology. We intend to have, as part of our program, a formalized internship program with Augusta University, so that students that are in their junior or senior year can go through the internship process and come in and work a semester in the center and actually do hands-on working of cases, as we do in many of our other work units throughout the GBI. We've had an internship program with the university system since 1972. It's been very beneficial for us. About a third of our agents were GBI interns in that program. We're also going to have unpaid fellowships for local law enforcement. So if a law enforcement agency wants to develop a expertise in working cyber crimes, they can come to our work unit in the center, go through a fellowship, and learn how to do these type cases, go back and protect their own communities. This is also a program that we have used with great benefit in our crimes against children unit, child sexual exploitation cases. We've trained law enforcement officers across the state of Georgia in how to work the cases in their community, and they go forward and do that. And this is something that the problem is too mammoth, and the sexual exploitation of children as it is in cyber crimes for the state of Georgia to do all the work.
Director, we've got a member that'd like to ask you a question.
Yes, sir.
If I could. Vice Chair.
Thank you, Director. I just want to follow up on that real fast. First of all, I'm extremely impressed with what you guys are doing with the cybersecurity thing, because that's where we're going. I mean, that's where we're going. And I do want to follow up on that about the fellowships that you were just talking about. What has been the response from the local public safety communities to that? What are they? Are they jumping all over and taking advantage of that opportunity?
They are we've not expanded, we will be expanding the fellowship into the cybercrime area. In the child sexual exploitation, there's been tremendous response. We've got over 240 agencies, law enforcement agencies, who have signed up to be part of the state task force. They send their investigators to us, and then we train them how to work these child sexual exploitation cases. Tremendous response. That's why the state of Georgia is so out front in this area. And by the way, it doesn't cost the state anything. We pay for their training through grant funds.
That's great. And then this may be a public relations aspect of it that might need to be answered or whatever. Do y'all have the resources to be able to get the message out to these to the locals that that this is available to them and encourage them to take care of it?
Yes, sir. We have a great outreach program through the Chiefs and Sheriffs Association, and
great.
We work every day with local law enforcement, so
well, obviously the problem's not going away, and anything we can do to bring it down to the local level would be great.
Yes, sir. That's our intent, because GBI through this center cannot handle all the cybercrime in the state.
Great.
The
Thanks.
secret is to do what we did in child exploitation, train local officers to protect their community.
Mr. Director, when we visited the Georgia Cybercrime Center, specifically for the child exploitation aspect of it, the room that we saw that you took us to visit was not even a quarter of the size of this room.
Right.
Now, that was where the computers are located. It was, but it was a very small facility where they were handling a lot of the cyber crimes for children. Where will the expanded unit be located visually, if you can tell me, in terms of a space requirement, because that seemed very small?
It would be, I would say it's probably going to be 5 times the size of the unit that you saw, the space. GTA has built out our working environment to our specifications to have, so that we're not crowded the way we are. What you've seen is the problem we've been experiencing is the child sexual exploitation unit that you visited. They keep being pulled in to work other cases unrelated to that. For instance, when there is a problem in state government, or a local government a local officer has a cell phone that's involved in a homicide and they need to get information downloaded. Well, that unit is the only capability that we have. The Cyber Center in Augusta will allow us to take on all these other cases and allow that sex crimes unit to stay doing what they need to be doing and what their grant pays for.
And despite the dual tasking that you have of your officers, I noticed that from Ms. Nellie Miles has put out some press releases on behalf of GBI over the last year. I know that 2 large stings were done in joint operation, I think, with Cherokee County and then another one with Noonan. That's right. And so we saw in those 2 stings over 30 individuals that were apprehended or at least charged with crimes that involve sexual child exploitation over the internet. At what rate are we seeing the growth of cyber crimes occur in the state?
It is, we've only touched a very small part of the problem that's out there, and that's based on lack of resources. The 2 operations that you talked about, it's important to remember it's not just GBI. We have to bring in local officers to help us, as well as federal agencies, because to do one of those operations takes 70 plus investigators. But we all work together, we can solve problems. But that's the only area that we're really addressing. We've got all this other cyber crimes out there that we will be able to expand to through the Augusta Center.
And where does the state rank in terms of the cyber crimes, especially in the region? Where do we fall out in terms of the amount of cyber activity that's occurring, cybercrime activity that's occurring in the state?
Across cybercrime, not just sexual.
Yes, all cyber crimes.
We're no worse than any other state. Probably I know we have a major problem just because of the size of our state and the good economy that we have here. one of the interesting parts about being in the center is we'll have direct access to all the federal agencies that are working this, as well as private industry, which has much more capabilities than government will ever have. That will give us an opportunity to have a realistic picture of what the threat environment is and what is actually occurring.
I think it would be good, I think, to have somewhat of a baseline,
Sure.
so that we can then measure that baseline against, so where we are today versus if we choose to recommend the addition of the
Yes, sir.
the furnitures, the one-time furniture allowance, which would presuppose that we'd also be allowing for the 8 new positions. In doing that, what we're it would be helpful to have that baseline so that we can see later on to what extent, you know, we're making these 8 individuals have made a dent in the existing cybercrime.
That's not a problem. We'll get a threat picture for the state of Georgia as it relates to cybercrime and give us, as you said, a baseline to fall back on.
And I'm aware that Nellie has provided, I think, to Courtney, and we have a concept paper on the cybercrime expansion. So we do have some of this information, but just wanted to try to make sure we are developing that baseline so we can know what we see going forward. Other questions about the cybercrime lab expansion? Or
Mr. Chairman, we rank 11.
Okay. And we're growing at what rate? I think it's in your report.
20 to 34%.
20 to 34. Okay.
We'll get one specific, though, to today's world.
So let's get some actual crime numbers, so we have a baseline set of numbers, and then we can see how they, you know, what, in terms of your activity, what we see next year and the following year after that.
Yes, sir.
Any other questions from members? Does anyone have any questions about the sexual assault, DNA sexual assault kits? I have a few, if you don't mind, Director. Dealing with this issue, we had allocated 4 positions last year, scientists, and then I think there were 2 tech positions. Is that right? I think that's right. And then in doing that, tell me again, what is the plan for after you've knocked out, and you're doing an exceptional job doing it, you're over 60% done with just the SB 304 sexual assault backlog. But what is the plan for those scientists after this is completed? Because the pace you're on, you should be done by the end of the year.
Yeah, we're working. That's our objective to do that. Of course, what these scientists are needed to do is to go after that 5,800 backlog of other DNA that's still in the lab.
Okay.
So we're working 2 things. We've got 2 tracks going here: SB 304 rape kits, other DNA cases that are out there.
And then also, in terms of the prosecutions, can we get some information about how these SB 304 kits are translating to actual cases that are being brought against individuals to prosecute for potential or alleged rape?
We can try. That's going to be a problem, because what happens is when we get the DNA CODIS hit, we notify local law enforcement and prosecutors of what has occurred. Then it becomes their responsibility to go forward with it.
And there's no,
They're not obligated, nor probably will report back to us what the outcome is.
Okay. Well, I think that's something I'd like to kind of follow up on with PAC and others.
the only indication really would be a subpoena to the crime lab to have that, the analyzing agent to come testify. That would be the only indication that it actually went to trial. Now, if it pled out, there would obviously be a subpoena. So.
If you wouldn't mind looking into that, see if the crime lab, your technicians or your scientists have been called in. I'd like to know what those numbers are, because there's an astounding number of rape kits that have been backlogged. And it's one thing to go through and test them all and find out and to clean up the kits, but that doesn't address the victims on the other ends, and it doesn't address the individuals that have committed the crimes. So we're cleaning up a backlog, we're cleaning up kits, we're making shelving space, if you will, but we're not putting people in prison that should be. And we may be. And so the question really is, I'd like to know where we stand on that. And
Okay.
to the extent that you can help provide us some information, at least as to transfer, then we can follow up from there.
Certainly. We'll do a research project on it, get the best data that we can get our hands on.
I mean, I think that just kind of a caveat to the committee, it's gonna be somewhat spotty, just because the nature of the way that works. Just turning it over to the prosecutors, it might be something better for PAC to answer.
We're going to chase that rabbit a little bit.
Yeah, well, the fact that you're asking questions will help us out with prosecutors. Reemphasize the importance of getting the work done.
There's a reason why the cameras are on. Many reasons. Yes, sir. Bill, go ahead. Or Gerald, go ahead.
All right, thank you, Mr. Chairman. Mr. Director, on the DNA, are you outsourcing those to other states, or are we handling those in-house?
We outsource some of our rape kits to private companies, and we've got the budget to do that. The problem is that all other states are doing the same thing we are. They've got backlogged rape kits. They're outsourcing them, and private industry has limited capacity. At one point, they were limiting us to 50 kits per month that we could outsource, and now they've upped it to 100, so that's helping us out bring it down. So it's a combination of working in-house and in our crime laboratory and outsourcing it. And we've got a federal grant and a grant from the district attorneys of New York to outsource to private companies.
What is the turnaround in regard to when you outsource like that? What's the turnaround for the information to come back to you?
We get reports every month, because the fact that they're taking 50 a month now, 100 a month. That's how many they're completing with their source.
Okay.
Our scientists in the GBI, and it's going to be the same thing in private industry, can do 18 to 20 kits per month. That's the workload.
All right, thank you, Mr. Chairman.
Thank you, Mr. Chairman. All right, Mr. Director, thank you very much for you being here today and the staff being here. Thank you for making the trip up this morning and or over, I guess it is really, from Panthersville. We're good to see you here. With that, Mr. Chairman, Mr. Director, we will follow up with those questions a little later, get the answers, and then be ready to go for the next round. With the time being 9:22, we're on schedule. So, Commissioner Niles will have you come up and your staff, and we're happy to have you here, and DJJ as well to present. Andrew, hello, welcome on board. It's nice to see you here as well, and we'll turn it over to you, Mr. Commissioner, to give us a presentation on the request dealing with Senate Bill 175.
Well, excellent. Thank you, Mr. Chairman, and thank you for the kind words that you said earlier about the men and women that make up our beloved Department of Juvenile Justice. And you are correct. We deal with what society says need to be rehabilitated and those individuals that need to be restored. You will find our section in section 31 of your tracking sheets, Mr. Chair and committee. We thank you for allowing us an opportunity to come and present. We'll start off with the 2.77138,359, and those are agency's premiums through our DOAS in section 31.1.1 as well as 2.1 and 3.1 in your respected sheets. Those are administrative increases. Also, Mr. Chair, in that same category, merit system increase, merit system assessment decreased by $91,543, and that's in section 31.1, 2.2, as well as 3.2 and 4.2. The next item, Mr. Chair, you will find is the provider for youth care doing the determination as it relates to competency as outlined in SB 175 on last year, as you recall. This provide for our competency beds up to 6 for restorable, and then 3 beds for the non-restorable youth. And those are items 31.1.3. Also in that same category, the governor recommends that we redirect $402,726 of state funds from our CSAC operations of youth competency, and that's where we're moving funds from one area to compensate for this area. Those CSAC operation funds were included in our FY17 budget. All of this increased funds to provide for youth care during the determination of competency. In SB 175, you all recall some of the critical issues that happen concerning our kids that's somewhat in the predicament of being able to stand trial in a competent manner, as well as those individuals that the courts have deemed that those individuals are non-restorable. So those are funds under SB 175 that we're following those guidelines. Of course, those competency beds went in effect in July of 2017. We contract with Deverell for the 6 restorable and then the 3 non-restorable beds. Mr. Chair, also those particular items bed-wise are at the same level of our other state entities, DBHDD, as well as our Department of Human Services.
That was a question that came up when I was listening to DBHDD's presentations on Tuesday, and in speaking with them afterwards. They're building a facility to provide competency beds, 40 of them, and so they're building a facility for, I think it was $2.2 million or so to house them, and then. But the cost of providing the beds through the contracted rate was exceptionally more. And in my brief discussion afterwards with them, they were telling me that the rate per bed was about $675 a day, which in doing that math would have worked out to about $1.4 million because the commissioner was talking about Senate Bill 175 and DJJ allocating 6 beds. They wanted to have 6 beds for the year allocated that they know they can use at any time when they have a competency question, that they can put the child there for competency determination and then services to render them competent. And so the cost of that was exceptional, but it seemed to me that the number, if that number is correct, about 675, then there's a $300,000 difference, $300,000 to $400,000 difference between what that same company, that same child caring institution, or it's not child caring institution, but a behavioral health clinic facility is charging DBHDD versus DJJ. So there seemed to be a significant amount of money in terms of a difference between those two rates.
Yes, sir. Mr. Chair, I checked to occupy a daily rate, it's $527 per youth per day. And then the unoccupied bed, those beds that's just waiting on the youth to be placed, is $465 per day per youth. So that's a little different than what you were told.
Mm-hmm. Okay.
And Mr. Chair, we also wish that we never have to utilize those funds for those restorable or non-restorable youth. But we put those funds in there just in case an opportunity presents itself that we have those funds available to be in compliance with SB 175.
And Mr. Commissioner, so when I do the rough calculation on that, if I err on the side of every bed occupied every day of the year, so 6 beds, 365 days a year at the rate of $527 per youth per day, I calculate $1.1 million, just over 1.1 million. So, but the request is 1.3 plus a redirect of 400,000, and then in the big budget, we're asking, DJJ is asking for 1.8. So I'm trying to understand the delta between those two numbers.
Yes, sir. And frankly, when we started looking at those the first year as well as now, it's a guesstimation. And we hope to work with whomever, Mr. Chair, to make sure that we do have the adequate numbers set aside for us to be good stewards with those state dollars, as well as if we have anything that remains, we'll be transparent with you, Mr. Chair, to make sure that those particular funds are earmarked so that those funds can be directed to where they need to be directed.
Okay, and Courtney reminded me this morning, that y'all had taken a pretty significant hit, $1 million hit last session, not from the House. And so, if we need to have some discussions regarding that, I'd rather have a transparent, open discussion. If that is impacting you, then we need to know that. And Courtney reminded me of this morning, and then I said, "Oh, I'm not going to ask about that." And then here I am asking about it. So that just tells you where the brains of the operation are. I think we need to. I think the committee should understand these numbers, and we need to have an accurate number.
Yes, sir.
I'm hearing estimate, but I'm now hearing we have actual numbers. I think we need to get that nailed down better and understand exactly what that number should be for the amended budget as well as the full.
Yes, sir. We will work diligently with our finance as well as our budgets to make sure that we're producing the correct numbers.
Okay.
Mr. Chairman, if I may.
Yes.
You were correct on your $1.1 million figure.
Andrew, yes, right.
You're correct on your calculation of that $1.1 million figure. There's an additional calculation, though, and those are for our 3 non-restorable beds that when you add that to the 1.1 million, that brings you to what our request is for the amended year. And the delta between the amended year and the full fiscal year is the ramp-up estimate that we used this year. Since this started in July, we knew that we weren't going to have all the beds filled in July, and so we used a ramp-up model. But then in the full fiscal year, we anticipated, a year after this started, that those beds would be at capacity or near capacity. So that's why you're seeing a higher request in the full fiscal year.
So is it 6 beds total, or is it 9 beds with 3 being non-restorable beds, which are children that are just ongoing psychiatric treatment, and then 6 beds that may have some that have achieved a level of competency, and then go back and are tried, or and then having those beds available to be filled as you need them?
It's a total of 9 beds, 6 for restorable and 3 for non-restorable.
Thank you. Okay, all right, well, I'll run that math a little, and just kind of double check the numbers with you, Andrew, and see, and with the committee. And I didn't mean to cut you off because you also have the Caldwell.
Yes, sir. And the last item, Mr. Chair, would be the, two more items. 31.2.3 is the cyber insurance premium of $6,937. That's a decrease over the past year, and that's a statewide change. And then last but not least, Mr. Chair and Committee, is the Cadwell RYDC furniture, fiction, and equipment. That's $750,000 that from the 2018 operational budget, those funds would be utilized from the operational end of it to make that facility whole, which will be coming online in 19. We're in the construction phase of those now, and we'll need those funds by this end of this year.
All right.
That concludes my presentation, Mr. Chair and Committee.
Questions from members of the committee? Good. Well, thank you, Mr. Commissioner. I appreciate you being here. Andrew, thank you for being here as well. Members of your staff, thank you all for attending. It's good to see everyone here.
Yes, sir.
With that, if there are no questions, then we will stand adjourned and go about doing the people's business in the big house.
Yes, sir.